Welcome to the Nursing Experts Translating the Evidence workshop. Our goal today is to help you learn how to find high-quality information and how to apply it to program development, policy writing, and grant writing. This project has been funded with federal funds from the National Library of Medicine, National Institute of Health, and Department of Health and Human Services. Our objectives for today are to identify additional quality web-based resources for public health practice information. Before we actually do any searching, I want to say a couple things about the process of searching for information. First, searching for evidence is a process. Nobody conducts a perfect search and finds everything that they want the first time. You will need to spend time searching, revising, and searching again until you have what you need or are sure that it does not exist. Here is our Pico search. High school students, STI education via social media versus standard education, with the outcome of decreasing risky behaviors and incidents of STIs. Our first resource is the Community Guide. It's a free resource provided by the Community Preventive Services Task Force. It is designed to help you choose programs and policies to improve health and prevent disease in your community. It contains a collection of online public health materials that will help users assess and carry out evidence-based public health strategies and interventions to meet their community's critical health needs. Let's take a look at the Community Guide more closely. Two of the most important resources on this site are the topic guides and publications and resources. In the topics, you can browse based on your population, like adolescent health, or by condition like STI. Let's take a look at HIV, STIs, and teen pregnancy. Second result, health communication and social marketing, campaigns that include mass media and health-related product distribution, looks like a really good fit for our Pico question. You can see that it's strong evidence. We click on it. Okay, and we can see a snapshot here that gives an overall review of the entire thing. Let's take a look at publications and resources more closely. This grouping of material is organized to help you support in the design, implementation, and evaluation of your own project. For example, if you select Community Guide Tools here, there are links to needs assessments and evaluation tools to gauge need and effectiveness. Overall, the Community Guide functions as a great starting place for finding evidence-based public health interventions for communities. Next is Partners in Information Access for the Public Health Workforce, or PH Partners. It is a collaboration of government agencies, public health organizations, and health sciences libraries. Their website is full of useful information but can be overwhelming. I recommend visiting the Health Promotion Health Education topic page as a great way to get started. Homepage for PH Partners. The middle section of the website is an easy way to start browsing the information available. Our intervention of health promotion via social media, I'm going to click on the Health Education, Promotion, and Campaigns one. Health Promotion page groups the information to a variety of categories. One area of relevance to our Pico is health disparities and health literacy. So let's take a look what information they have here. A lot of this could be really helpful to our project. If you're not finding the materials using the browsing methods, try the search box. We're going to use phrase searching here, which is when we put information in quotes to search the whole phrase. So social media and adolescent, we get about 100 results, many of them highly relevant to our Pico question. Overall, PH Partners is a great resource to seek public health information from reputable sources of evidence. Finally, the CDC is another resource that I'm sure you have all visited in one way or another. There is so much information that it can be difficult to find anything, but when you know what you're looking for and the source of that information, it can be much easier to find. Here's the CDC website. The main page has a few quick access points for public health information that can be easier to navigate. We go to Diseases and Conditions, several menu options including sexually transmitted diseases. So we have information about preventative programs and our target population of adolescents. Also continue to look, we have key resources, data and statistics, prevention, lots of other tools and specific information. Another area of the CDC that public health professionals should seek information is from the Center for State, Tribal, Local, and Territorial Support. You can find this information under the More tab right here. By browsing, you can locate data on populations, successful program implementations, and toolboxes. Finally, if you are still not able to find what you need, you can try the search box as a way of navigating the CDC. For example, if I want to find the prevention status reports, I'm going to put that in quotes. And hit search. Over 100,000 results, I'm lucky the first one is exactly the one I need. The Prevention Status Reports highlights the status of public health policies and practices designed to address 10 important public health problems and concerns across all 50 states and the District of Columbia. Click on Illinois. It's a good place to start with a problem that you see in your community to see what other states have done. In conclusion, while the CDC website can be overwhelming, it is an essential health information resource that can help support any public health worker find evidence for practice. This concludes the second module of the Online Resources section of the next Public Health course. Please move to the next module to learn more about finding resources on the web.